Women are very keen to know what labour will feel like, what symptoms they will get, and how they'll know when it's time to go into the hospital. These are things that you'll learn from seeing a midwife or having a course of antenatal classes. Partners are also very important here. Most fathers-to-be are really keen to be involved and to help. How do you know that you are in labour? Women really want to know the answer to this question. You've not been in labour before and get very anxious about knowing what the signs are, knowing when to go to hospital, and knowing what is normal and what is not. It's quite hard not to know when you are in labour, but it's very easy to mistake being in labour for the early part of pre-labour, which isn't labour at all. It's preparation and the build-up to labour. Most women on average will have about 12 hours of labour. That will vary an awful lot from one woman to another. Some women have a mild pre-labour stage, which means that they just feel the odd ache and pain, and then they go into proper labour straight away with regular painful contractions. Other women are very aware of the early stage of pre-labour and find it very uncomfortable. Nobody knows how it will go for you, because unless you've experienced labour before, it's impossible to tell how your body will feel. Towards the end of pregnancy, sometimes even in the middle of pregnancy, a lot of women will get quite strong Braxton Hicks contractions. This is just a quite tight, strong, painless hardening of the womb, and all that's happening is the womb is practicing. The womb's a muscle and is flexing and practicing for when labour really does happen. These can be very strong in some women, and other women don't feel them at all. All women have them, but not all women feel them. If you've had a labour before, you may have some experience of what this feels like, or you may be having a totally different kind of birth experience from that you had before. You may also be having your first labour having had a caesarean section before, so that means you don't know what labour feels like. Thinking about normal birth and remembering that the vast majority of women, if they want to, can have a very normal pregnancy and normal birth. In medical terms, we divide labour up into 3 stages. The first stage is from the onset of active proper labour until the cervix is fully dilated. Then the second stage is from then until the baby is actually born, and the third stage is the delivery of the placenta. But for women, these 3 stages are not nearly so clear-cut, and it's the beginning of labour that's the most difficult one to judge in the right way. You don't need to be an expert in knowing what symptoms you're going to get and how long you're going to have these symptoms and when you need to go into the hospital, because your body will tell you. The beginning part of pre-labour, sometimes called early labour or false labour, can be as short as a few hours. Some don't even feel it very much at all. Some women feel it very strongly over the course of several days when it stops and starts. Most women are somewhere in between the two. When contractions start, they're generally very irregular in how far apart they are, how long they last, and how strong they are. It's only when contractions get close together, 3 to 5 minutes apart, are lasting at least a minute from beginning to end, and you certainly wouldn't be able to talk through them, that's when we would say that you're in active labour. You'll know by how you feel and what's happening on the outside of your body when it's time to go to hospital. Most first-time mothers will usually end up going into hospital once or twice to find out that they're not actually in labour, and this is all pre-labour symptoms. That's perfectly normal, but it's a good idea to get enough information about what you might feel so that you can judge whether you should be going into the hospital. One of the things that you can do if you're not sure is call your midwife and ask her advice on whether you should be going in. All the way through labour, your baby should be making the normal number of movements that you're used to him or her making during the last part of pregnancy. It's not true that babies move less towards the end of pregnancy and during labour, and if you feel that is happening, you should get advice from your hospital. Most women are very keen to know about what pain relief is available for them during early labour and active labour, and in fact after the birth as well. There are lots of things that you can use to relieve pain, and finding out what they are and how they can help is something you can do during pregnancy.